I'm Lauren Meffin, speech pathologist and certified lymphedema therapist. Let's take an inside look at one of our patients. The symptoms. It burns when I am biting into food. Sometimes my tongue burns all the time, and I feel as if things are getting stuck. And the patient points to an area right here in this region. The patient has been through 2 years of survivorship, completion of radiation, definitive radiation, and chemotherapy for base of tongue tumor. Now, what we are going to see is the inside with the fiber endoscopic swallowing study. Here at our clinic in Gainesville, Florida, we want to help our patients determine what is the best next step. Let's explore. First, I'm going to orient you just a little bit. In the middle of the screen, this region here, these are the arytenoids. Those are cartilages. And then we're going to take a look at the vocal cords, the airway. And back here, I like to call these little pockets, or not just myself, but all speech pathologists love to call these pockets, piriform sinus. And you'll start to notice that there's a green tint that the patient has already drinking different consistencies. I'm looking to see what residue is left over in this particular patient as they are pointing to this region that is consistent with the opening of the upper esophageal sphincter or bilateral piriform sinus or kind of a globus sensation. So we're going to go ahead and play it. And there, I'm able to get a closer look at the base of their tongue and looking for what we are seeing with post-swallow residue. So, in that patient, I'm able to take a look at the base of their tongue. The base of their tongue is the back of their tongue. Then I start to kind of zoom in and see what's happening at the level of the piriform sinus or the upper esophageal sphincter. In that patient, we would describe that as mild or trace residue post-swallow. Those patients feel as if things are sticking here. They're also describing it along the back of their throat. Join us for further studies with this patient as we explore the back of their throat and what's happening at the posterior pharyngeal constrictors. So, what have we established? A fiberoptic swallowing study helps us to objectively evaluate what is happening with our patients and ensure that their symptoms are consistent with what we see in the clinic. Now, I will take this information, I will help this patient in being able to decide what are the next steps. Overall, I was incredibly pleased with what I saw in this patient's swallowing study 2 years post-treatment. So they are going to gain a boost of therapy from me, but also reassurance that they are doing amazing as well. What will the therapy look like? We are going to incorporate chin tuck against resistance, EMST 75, manual therapy for this patient, bolus loading. All of these things are going to help their symptoms on a daily basis. They are going to do amazing with a home exercise program, and I felt reassurance by not seeing a significant amount of internal edema 2 years post-treatment. So, not only does the endoscopy allow me to assess what's happening with the food and the bolus, and that can give me guidance about the musculature, but I can assess internal edema and how I'm going to help manage this patient. Thank you for following us. Continue to join us as we learn more through patient case studies.